Welcome to Angel Health Academy. Topic for the day or topic for the session is healthcare agencies. Our country or nation is rich with many healthcare agencies, various different types of healthcare agencies, both private healthcare agency and government healthcare agencies. The main functions of these healthcare agencies in India are: first one is to promote the health of the people or our citizen, okay, promote the health of the people. Second one is to prevent the various illness, communicable and non-communicable illness. And third function is to provide curative services to the public or citizen, curative services to the citizen or to the public, okay. So it has got three P's: promote, prevent and provide. Promote the health, prevent the illness and provide curative services. Next is aim of healthcare agency. The major aim of the healthcare agency is to reduce the mortality and morbidity rates. Mortality means death rate, okay, number of deaths. Morbidity means number of disease occurrence, incidence of any diseases, both the communicable and non-communicable diseases. So the ultimate aim of the healthcare agency is to render the quality health services, thus to reduce the mortality and morbidity rate of the people with the different health problems. These can be achieved by the following measures. First one is reducing the levels of poverty among the people. So reducing poverty, increasing the literacy rate, education of the public, okay, increasing the literacy rate, especially women literacy. Then provision of or provide safe water, especially to the rural people, and safe food supply, okay, that is balanced diet to the public or to the people, especially for the underwise children, old age people, okay. Then development of manpower resources. Manpower is nothing but the staff to render the healthcare services. We have a shortage, acute shortage of the healthcare personnel or manpower. So promote the or increase the number of the healthcare staff or medical staff to render the health services, especially in the rural area, okay. Then improvement in sanitation facilities. So we have sanitation problem in India. To prevent that or thus to improve the sanitation facilities. Then improvement in nutritional status of the people, okay, especially under 5 children, pregnant women, okay, old age people, etc. Improvement of the nutritional status of the people, that is make the people to get adequate nutrition according to ICMR recommendation, okay. Reduction of population growth rate. India is the most populous country, okay. At present we have 145 crore population, more than 145 crore population. So reduce the population growth rate in India. Then rendering the basic services or curative services to the public or primary health care to the public. Then provision or provide the promotive and preventive services through the health centers, provision of promotive and preventive services. Now let us talk about the type of various healthcare agencies. Type of healthcare agencies. So healthcare agency can be divided into, as per the governance, that is government or public health agencies and private healthcare agencies. So according to the control of the particular healthcare agency or health infrastructure, it can be classified into government or public or private healthcare agency. First one is government or public health agencies. We have many government or public health agencies that we have discussed in the last videos, okay, when we discussed about the healthcare delivery system in India, okay, its concept. So if you have not seen that, please go through and watch that video. You will get an adequate idea about the government sector. Now we are talking about the healthcare agency under government or public. So I have been made a table with the type of care, that is primary, secondary, tertiary care, okay. We have 3 types of basic healthcare services to the public that is given by the government. I have been already uploaded a video of levels of healthcare, okay. In that it is clearly discussed and explained what is primary care, what is secondary care and what is tertiary care. So levels of healthcare is primary, secondary, tertiary and other specialty services, okay. Then healthcare infrastructure, it is nothing but health organizations where the people will avail this primary care, secondary care or tertiary care. Healthcare infrastructure, okay. Primary care is given from subcenter, that is a peripheral remote government health center at village level, that is called a subcenter. Then PHC, at Panchayat level, government is having PHC to render the primary care or primary health care to the public. Then secondary health care is availed from the community health center at block level. Okay, each block is having one community health center. Then it is also available from Taluka headquarters hospital at Taluk level and sub-district hospital at subdivisional level. Okay, in that video I have explained the districts are divided into 2 or 3 subdivisions. Then each subdivision again divided into Taluk and Taluk into urban and rural area. Okay, so secondary health care is provided by government sector such as community health center, Taluka headquarters hospital and sub-district hospital. Then the last care, that is tertiary care, it is given by district hospital. Okay, then medical college hospitals and various research institution at state level or regional level. Then other services is given by specialty hospital. Government has various specialty hospitals for mother and child, for pediatrics and particular specialty. Okay, then government also have national research centers, for example NIMHANS, AIMS, etc. That is the national research centers to render the advanced medical care and conduct various research in medicine and healthcare aspects. Okay, so these are the government or public health agencies to render the services, that is sub-center, primary health center, community health center, Taluka headquarters hospital, subdivisional hospital, general or district hospital, medical colleges and national level health institution or research centers. Now this diagram also I have mentioned, I have already shown in the video of levels of health care. Okay, thus we have 3 levels of care, that is primary, secondary and tertiary. Primary is rendered by at village level by sub-center and primary health center. Secondary at block level or Taluk level, it is given by community health center, Taluk headquarters hospital and subdivisional hospital. Then tertiary level, it is given by district hospital at district level. Then at state level, regional hospital or medical college hospitals, and national level we have various national hospitals, that is super specialty referral hospitals. Now let us talk about the second type, that is private healthcare agency. So government has limitation with the budget and other things. So government has a few healthcare agencies, but the private has different type of healthcare agency to render different type of services. So first one is outpatient clinic or polyclinics. So private healthcare agencies having clinics, outpatient clinics, OPD clinic. Then nursing homes or long-term care center for the chronically ill patient, nursing homes. Third one is hospitals, private hospitals. Then ambulatory care agencies, that also daycare services, that is ambulatory care agencies. The fifth type is emergency care centers to render the emergency services. Then sixth one is dialysis centers to render the services in relation to dialysis, that is for the chronic kidney disease patient. Then birth centers to promote the delivery of the baby in the normal cases. Then diabetic centers or diabetes clinic for the diabetic patient. Then rehabilitation centers for the mentally ill and substance abuse people or for the drug addicts, etc. Then laboratory and diagnostic clinics to conduct the various lab tests and diagnostic measures. Then 11th one is de-addiction center, that is for the alcoholic patients or for the drug addicts. Okay, de-addiction centers. Then mental health centers for the mentally ill people to provide services for the mentally ill people. Then dental clinics, hospice homes, that is for the chronic ill or terminally ill patients will get home based care, that is called hospice homes. Then telemedicine centers where telemedicine services are available. Okay, telemedicine center, and 16 is others. So there are mainly 15 important or different or various private healthcare agencies in India to render different types of healthcare services to the public. Okay, so let us discuss in detail or in brief about this 16 different type of private healthcare agencies. First type is outpatient clinic. Outpatient clinic are the healthcare facilities where the public will get healthcare services that provide especially medical services or curative care to the patient without requiring them to stay overnight. So there is no need to stay in the clinics, patient can go after getting the treatment. Okay, usually it works for the daytime. Okay, that is outpatient clinics. Patient can come and get the consultation from the doctor and can receive the medications and necessary primary health care or treatment, then they can go back to their home. Okay, these clinics offer a range of different services such as diagnostic measures, therapeutic services or treatment modalities, preventive care, vaccinations and treatment services on an outpatient basis. Outpatient means the patient is not getting admitted. Those patients are called outpatient. Okay, on an outpatient basis, meaning patient come in for care and they leave the same day from the clinics or health center. Then outpatient clinics are a convenient alternative to hospital for non-emergency condition and routine medical care. So this outpatient clinic, it is a convenient and it is an alternative to the hospital for non-emergency people. The patient with non-emergency condition, actually they have some problem, but there is not required emergency services or urgent services. Such cases can be dealt in the outpatient clinics for the routine medical care or for general health services. So outpatient clinics are a convenient alternative to the hospital for non-emergency conditions and routine medical care or routine health care to the public. Then second one is nursing home or long-term care centers. Nursing home is a small private institution that is governed by private sector. Okay, small private institution providing residential accommodation. So patient stay in that hospital for a prolonged period for a chronic condition. So it gives the residential facilities. Okay, they can reside in the hospital providing residential accommodation with health care, especially for the elderly people. Okay, chronic ill people and elderly people, they may not be taken care by the family members at home. These people are shifted to nursing home and they will get the continuous services. So nursing home provide treatment and care for all the chronically ill patients and terminally ill patients. Terminally ill patient means a patient at the end of life or the last stage in the life. Those people. Okay. Then third healthcare agency is hospital agencies. So there are many private hospitals. Okay, they are under the health services, both IP and OP services. Inpatient services with the patient admission at the or in the hospital, and outpatient services in the OP services. Those patients can come and collect the services and they can go back. Okay, there is no need to get hospitalization or admission. It includes private hospital, specialty or specialist hospitals, private medical college hospital and super specialty hospital. Some of the state they have a private medical college hospital, and some of the state like Kerala we don't have a private medical colleges. Okay, so under private sector we have many hospital agencies according to the type of services they render to the public, such as private hospital, specialty hospital or specialist hospital, private medical college hospital and super specialty or multi specialty hospitals. Fourth one is ambulatory care agency. Ambulatory means a patient can walk. Okay, ambulation. Ambulatory care agencies are healthcare organization or healthcare setting or facilities that provide medical or curative services to the patient on an same outpatient basis, like OP clinics. Here also outpatient basis, patient will come and patient gets the services and they will go back. Okay, patient do not require an overnight hospital stay in the ambulatory care agencies. Ambulatory care agency also known as or as synonym with outpatient care or outpatient clinic, and it can take place in variety of settings such as clinics, medical offices, okay, specialized healthcare centers, where we can arrange the ambulatory care agencies. Okay, so ambulatory care agencies are same as the outpatient care services where outpatient care is given. So it can be arranged in the either in the clinic or in the medical offices or in the specialized healthcare or health centers. This ambulatory care agency provide or offer wide range of diagnostic services, therapeutic or treatment services and even preventive healthcare services. Okay, that can be completed in a single day or in a few hours. There is no need to stay for 24 hours. Okay, or overnight in the ambulatory healthcare center. Patient can come, get the services and they can go. Then fifth one is emergency care centers, where emergency care is given. Emergency care centers also known as urgent care centers or emergency rooms. That is depending upon the type of services it is rendered. Okay, either urgent care or emergency room. These are the healthcare facilities like other healthcare agency which provide immediate medical attention or medical services for the patient with a different illness or even injuries, okay, that are acute but not life threatening. Only acute cases dealt in the emergency care center, not life threatening cases. Life threatening cases are referred to the hospital center where more facilities are available. Okay, hospital has also got a big emergency department with all the facilities to treat the people with the life threatening condition or trauma or injuries. Okay, so here in emergency care centers we will treat only acute conditions but not life threatening cases, or even serious medical emergencies also not dealt in the emergency care centers. That is shifted or that is referred to the hospital setting where medical emergency facilities are available. These centers offer the care to the patient who need urgent medical treatment but do not necessarily require the intensive resources or intensive care, okay, of a full hospital emergency department. In such cases, if the patient is required intensive care, then patient will be shifted to the hospital emergency department with the full-fledged facility intensive care unit where it is available. That type of the hospital can be considered and refer the patient for the life-threatening cases. Okay, that is about the emergency healthcare centers. Sixth one is dialysis centers. So you know that renal dialysis center for the kidney disease patient, for example, is patient with acute kidney diseases, CKD. Okay, a renal dialysis center, sometimes referred as a dialysis center, is a hospital based or independent unit. Either it is connected with the hospital or the independent dialysis center only for the dialysis purpose. Okay, that is outpatient services, or independent unit approved and licensed to provide the outpatient dialysis services for the CKD patient. So patient can go there and within 3 hours they can get to dialysis and they can come back to the home. Okay, so dialysis is a life-saving treatment for those with the chronic kidney failure or chronic kidney diseases, that is CKD, and takes over the kidneys as it cleans the blood. So dialysis machine will function as the kidney that is clean the or purify the blood of the patient during dialysis process. Then seventh one is birth centers. Birth centers. A birth center is a healthcare facility which provide a facility to conduct the labor, that is delivery, and a childbirth experience for the women in a family friendly home like environment. It is not like a hospital setting, it is like a home only. Okay, arrangement is like a home environment, so they will get a natural experience of the childbirth, that is friendly atmosphere, home like environment. Okay, this can be given only for the healthy or low risk pregnant mother only, not for the high risk or risky pregnant women cannot be preferred to deliver in the birth centers. There may not be much facility to take care of the emergency situations. Okay, so it is for the low risk pregnant women and for the normal pregnant women to conduct the delivery as a natural way in a family environment or home like environment for the healthy antenatal mothers. So there is no risk for the mother and no risk for the child. In such a situation, the normal pregnant woman could prefer the birth center to deliver the baby, okay, in a home like environment or in a family friendly atmosphere. Thus, it is an alternative to the hospital birth. Instead of hospital, they can go to the home-like environment and give to the childbirth. But it is only for the low-risk pregnancies. Okay, those the pregnant women who have a risk or who are comes under high risk cannot be preferred birth center. Okay, and is typically designed to offer a natural birth experience. The mother will get the natural birthing experience with minimal medical interventions and with complete family support. Okay, birth centers emphasizes family centered approach. Okay, all the family members can avail during the period of that delivery, okay, or childbirth. Okay, that is the birth center's importance to the family members. Thus it considers the family centered approach to conduct the delivery. Okay, Then eighth one is diabetic centers or diabetic clinic. As the term indicates, you know that it is for the special clinic for the diabetic patient. Diabetic clinics give the chance to meet the medical expert or the endocrinologist who can check the health as possible and give highly specialized advice and care to the diabetic patient on how to look after the diabetes. Okay. The service of diabetes center cover risk assessment or assess the complication status of the particular diabetic patient, then diagnosis, then comprehensive treatment under the supervision of a endocrinologist, okay, and other physicians, specialized physicians in diabetes medicine. Okay, so that is the diabetic center or clinic to render the comprehensive services and treatment care for the diabetic patients. Next is ninth one is rehabilitation centers. Rehabilitation centers are the other specialized facilities that provide the therapeutic services, treatment services for the individual, which help the individual to recover from the any physical, mental or substance related conditions. So physical disability, mental disability or substance abuse related disability all can be treated or regain back to the normal position of this type of patients in rehabilitation centers. These centers are designed to restore the individual abilities. Due to this physical disability, mental disability, patient might be lost his physical abilities or functional ability or daily activities abilities. That has to be bring back through the exercise or rehabilitation programs or counseling programs. Thus, these centers are designed to restore the individual's abilities to improve their overall health in the future and to help them to reintegrate into daily life as following daily activities of daily living by person or individual himself. So there are different types of rehabilitation centers. Rehabilitation centers can vary in focus depending upon the type of rehabilitation they are being offering to the patient. The major type of rehabilitation centers includes physical rehabilitation center, substance abuse rehabilitation centers, mental health rehabilitation centers, vocational rehabilitation centers where the patient will get the training for his job, okay, to continue the job. So or patient will get training for to start or rebuild the new work, okay. For that he may be getting different type of training under vocational rehabilitation centers. Then cardiac and pulmonary rehabilitation centers for the cardiac patients, okay. So these are the some of the important type of rehabilitation centers where patient will available different type of rehabilitation services. Then 10th one is clinical laboratory or diagnostic clinics. You know that there are number of clinical labs by the private sector. Okay, clinical laboratories or diagnostic clinics are healthcare facilities providing a wide range of laboratory procedures or blood test or other specimen test. Okay, which aid or which help the physician in carrying out the diagnosis, treatment and management of patients. So usually in government sector, patient might be sent to the private clinical laboratory where facilities are more available than the government sectors for the different type of diagnostic measures. Okay, then they go back to the government sector and patient can be getting adequate treatment with the help of the report of this diagnosis. Okay, thus private sector has got a number of clinical labs and diagnostic centers in different areas. Then de-addiction centers. So de-addiction centers means a center to treat the addict people of their addictions, alcoholic, drug addict, etc. So de-addiction treatment is a comprehensive approach to addressing the substance addiction and dependency of the particular substance. Some people have dependency to some particular drug or dependency to alcohol, etc. Okay, for them complete physical, mental, social comprehensive services is governed under de-addiction centers. Okay, even government also got some de-addiction centers for giving the de-addiction treatment. Okay, then mental health centers or mental health facilities. Mental health center means a facility providing the services for the prevention and diagnosis of mental illness like psychosis, neurosis, okay, mania, depression, etc. Okay, mental illness for the diagnosis of those mental illness and prevention of the mental illness. Then moreover it is given direct care to the mentally ill patient and even rehabilitation services for the mentally ill patient and both rehabilitation and treatment for the mentally ill patients. Everything will be available in the mental health centers. So private sector also holding different type of mental health centers to treat the mentally ill patient, because in government sector there is no enough facilities for the mentally ill patient to get the treatment. Then dental clinics. Nowadays it is very common a dental clinic or a place or facility where a dentist and a dental staff perform oral health treatment and dental procedures. For example, cleaning the teeth, etc. Okay. All the necessary dental tools and equipment are typically housed in a single room and where a dentist can take care of the people with their oral condition, okay, or different oral or dental problems. That is about the dental clinic. Then 14th one is hospice home. A hospice home is a specialized residential facility where the family can stay there. Okay, a hospice home is a specialized residential facility or care setting that provide end of life care for individual with terminally illness. So all the terminally ill people or individual at last stage is called end of life care. Such facilities are arranged in the hospice home. Okay. Hospice home is a specialized residential facility like living at home only. That is a healthcare setting which provide services to the or care to the end of life care for the individual with the terminal illness. Thus, it is a peaceful, supportive environment for the patients who are in the final stage of the life, end of the life. And moreover, they provide the emotional support, psychological support and practical support of the family members to understand the particular situations and adjust with the particular problems. Okay. So, hospice homes provide the care to the terminally ill patient, end of life care along with the family members, and they also provide the emotional and practical support to the family members in such a situation. Okay. Then 15th one is telemedicine centers. So at present we have number of telemedicine centers. It is a facility or platform that provide healthcare services remotely using telecommunication technology. So we use communication technology. Okay, telecommunication technology, and the patient will get treated from one place with the doctor in other place. That means it allows the patients to consult the healthcare professionals such as doctors, nurses without needing to be physically present in the same locations. So in telemedicine there is no need of actual presence of the or physically presence of a doctor. Doctor can be in a other country or in abroad. Okay, so through this communication media they will be connected. The doctor will give needed information and instruction to the patient and he prescribe the medication and patient follow that. So these centers allow the patients to consult the healthcare professionals such as doctors and nurses without needing to be physically present in the same location or in that healthcare settings. And it is mainly done by using video conferencing through mobile phone calls, mobile apps, okay, or even online portals. Okay, and it provides consultation services, diagnostic services, treatment services, even follow-up services. All the services may be available in the telemedicine centers. That is done through video conferencing or video call or phone calls or mobile apps or online different portals are available through which patient can get the telemedicine's healthcare services. Then 16th one is others. There are many other private sector healthcare agencies such as genetic counseling centers, that is giving counseling to the couples who are going to have a child. Okay. Then industrial healthcare centers for the industrial people, USG or MRI scanning center, special scanning center to do ultrasonography and magnetic resonance imaging, that is MRI scanning, etc. Okay. And we have number of optical centers where opticals are available and even the consultation also available with the eye specialist in the optical centers. So these are about the different types of healthcare agency in the private sectors. So today we have discussed about the various healthcare agencies of the government and private sector. It is a simple topic and you can understand by reading the heading of the health centers. According to the heading or title of the healthcare agency, it provides their particular services to the public or citizen. That's all. Okay. Hope this video really benefits in your studies and exams. If you feel it is worth and beneficial, please like, share and subscribe my channel and stay tuned with Angel Health Academy for the next and important academic video. Okay. Don't forget to subscribe my channel and once again thanks for watching my video.